Good evening and warm greeting to everyone joining us today. I am Nandana, Digital Coordinator at Dr. K.V. Vijith Institute of Ayurveda Medical Science Private Limited. And it's my pleasure to be your host for today's webinar titled Holistic Symptom Management of Parkinson's Disease through Ayurveda and Lifestyle. We truly honored to welcome you all this evening, participants from diverse backgrounds, united by the shared interest and concern for understanding Parkinson's disease and exploring meaningful integrative approaches to care. Today's webinar is not just about a medical diagnosis, it is about life with Parkinson's, the daily challenges, the subtle early changes, the visible and invisible symptoms, and most importantly, the hope for better quality of life through holistic patient centered care. Parkinson's disease affects not only the individual living with it, but also families, caregivers, and the wider community. Through this session, we aim to shed light on how Ayurveda, Panchakarma, and mindful lifestyle practices can play a supportive role in symptom management, restoring balance, and enhancing overall well being. We are privileged to have with us an unusual panel of experts from VIAMS, clinicians, and professionals who have dedicated their work to neurodegenerative care, integrative healing, and compassionate long term patient support. Before we begin, I would like to extend my sincere gratitude to all our participants, patients, caregivers, healthcare professionals, students, and members of the public for joining us today. Your presence reflects a shared commitment to awareness, empathy, and holistic healthcare. Allow me to briefly outline the flow of today's webinar. We will begin with a keynote addresses by our Chief Physician and Managing Director, Dr. Vijith K.V, who will lay the foundation with an in-depth session on the introduction to Parkinson's disease and its motor symptoms with special emphasis on gross and fine motor functions. This will be followed by expert session on understanding non-motor symptoms in Parkinson's early and first manifestation by Dr. Needu S.Jit, Director at VIAMS and Specialist in Neurological Rehabilitation. Role of Ayurveda, Therapies and Panchakarma in Parkinson's Care by Dr. Aditya Tangappan, Resident Medical Officer. Daily Routines and Lifestyle Modification, a Holistic Approach by Dr. Prasida AP, Healthcare Advisor. And the end of all session, we will have an interactive question and answer segment. I warmly encourage all participants to post their questions in the chat box. We would love to hear from you. Now, with great respect and immense pleasure, I invite our keynote speaker, Dr. Vijith K.V, Chief Physician and Managing Director of VIAMS, a visionary clinician who approaches the foundation of Parkinson's care with clinical clarity, experience, and purpose. Doctor, the virtual stage is all yours.
Good evening, all. Thank you, Nandana, for the introduction. So, today we begin with what is Parkinson's disease. I hope I'm audible to everyone, correct?
Yes.
Thank you. So, Parkinson's disease is a progressive neurodegenerative disorder affecting the central nervous system and movement, primarily the brain networks that controls movement. But let me emphasize one key clinical truth. Parkinson is not only a movement disorder. It is a whole body disorder affecting the motor control, the autonomic system, sleep regulation, cognition, emotions, and gut function. So today, I will cover the motor symptoms of Parkinson's disease. So motor symptoms means what the world sees. Trap, tremor, rigidity, echinacea, and posture, because they are the they are often the first signs that bring a patient to the clinic or a doctor. So the motor symptoms mainly affect walking, stability and balance, arm swing, posture, turning in bed, daily physical independence. However, Parkinson's motor symptoms are not the same for every person. Some have dominant tremor, some have stiffness, slowness without tremor, some struggle mainly with walking and freezing. So, understanding the types of motor symptoms helps both clinicians and families manage expectations and plan care. So, tremor type in Parkinson's disease. We can say resting tremor, postural tremor, action tremor, re-emergent tremor, jaw, lip, chin tremor. So tremor is most familiar symptom of Parkinson's, but clinically we must understand that not every tremor is the same and not every tremor indicates Parkinson's disease. In Parkinson's disease, tremor can present in multiple forms: resting tremor, postural tremor, action or kinetic tremor, re-emergent tremor, jaw, lip, and chin tremor. Each form gives clues about the disease stage, pattern, and also helps differentiate Parkinson's from essential tremor. Let's see, or let's talk about resting tremor. This is the most common tremor in people with Parkinson's disease. So, resting tremor is the classical Parkinson's tremor. It is seen when the body part is relaxed. For example, when the hand is resting on the lap. It is often described as a pill rolling tremor, while the thumb and fingers seem to roll an invisible object. So, a key clinical feature is it reduces with voluntary movement. So, when the patient reaches for something, tremor can temporarily decrease. It often begins on one side. This asymmetry is an important hallmark in Parkinson's disease. Next is postural tremor. Occurs against gravity, can resemble essential tremor. So postural tremor occurs when the patient maintains a posture such as holding arms outstretched. This tremor is usually subtler than resting tremor. It may overlap with resting tremor and can sometimes confuse diagnosis. So, this is where clinical experience matters because essential tremor is common globally, including in European populations, and needs different management. So the next is action tremor or kinetic tremor. So this occurs during movement, usually mild. So action tremor happens during active movement. For example, reaching for a glass or picking up a small item. So in Parkinson's disease, action tremor is typically mild and not dominant. But in later stages or in specific individuals, it can become more noticeable and impact fine motor tasks. Next is re-emergent tremor. So the resting tremor disappears and reappears after delay in posture. This is known as re-emergent tremor. So re-emergent tremor is very characteristic Parkinsonian pattern. Here's what happens. The tremor may stop when posture is changed. Then after a brief delay, it returns again. So this helps us differentiate Parkinson's tremor patterns from essential tremor patterns, especially in early diagnostic confusion. Next is jaw, lip, chin tremor. So the lower face tremor at rest, head tremors are very rare. Some patients may experience tremor around the jaw, lips, or chin. This is usually present at rest. Interestingly, head tremor is rare in Parkinson's disease. Voice tremor is very uncommon in Parkinson's disease. So the location and pattern of tremor is clinically important. So next we move to rigidity in Parkinson's disease. So lead pipe rigidity, cogwheel rigidity, axial rigidity, limb rigidity. Now, when we talk about rigidity, which is often more disabling than tremor, rigidity means increased resistance in muscles even when the patient is relaxed. It affects posture, flexibility, walking, and daily comfort. It can create pain, fatigue, and sleep disturbances. So, rigidity in Parkinson's is commonly described in forms lead pipe rigidity, cogwheel rigidity, axial rigidity, and limb rigidity. So, lead pipe rigidity. This in lead pipe rigidity, uniform resistance will be there throughout the range it will affect, and even without tremor it will be seen. So, lead pipe rigidity feels like a constant smooth resistance. It is present through the entire movement range, whether we bend or extend the limb. So, the one key feature is it is present even if tremor is absent. So, a patient can have Parkinson's with major rigidity and minimal tremor. So, let's see what is cogwheel rigidity. Ratchet like jerky movement, tremor plus rigidity. So, cogwheel rigidity is the ratchet like rigidity we describe in classical teaching. So, it happens when lead pipe rigidity is combined with tremor. So, as we move with the limb passively, it feels like jerky steps, like a gear. So, clinically, we often detect it best in the wrist and elbow. Next is the axial and limb rigidity. So the neck or trunk stiffness, stooped posture, bed turning difficulty will be there in axial and limb rigidity. So the axial rigidity mainly affects the trunk and the neck. This contributes to stooped posture, reduced spinal mobility, difficulty turning in bed, increased risk of imbalance. So axial rigidity often responds less predictably to dopaminergic therapy. This is why supportive therapies are very crucial. Limb rigidity affects arms and legs and can start asymmetrically early on, causing reduced arm sync and stiffness. So the next is the gait abnormalities. That is the shuffling gait, fascinating gait, freezing of gait. So walking changes are often the turning point where patients lose confidence. The most common gait patterns include Parkinsonian shuffling gait, fascination gait, freezing of gait, start hesitation, end block turning, and later stage postural instability. So these are not simply walking problems. These are risk factors for falls, injury, and fear related immobility. So, Parkinsonian or shuffling gait. Shuffling gait is when steps become shorter, slower, and feet do not clear the ground properly. You may notice reduced or absent arm swing, stooped posture, narrow base of support, hesitation when starting. So, this affects confidence and increases fall risk. Next is the fascinating gait. So the speed increases, chasing the center of gravity. So fascination is when steps become faster and shorter. The patient appears to be chasing their on forward leaning posture. Stopping becomes difficult once the movement begins. This can be frightening for patients and caregivers because it feels like loss of control. Next is the freezing of gait, FOG or fog. So feet glued on the floor or triggered by turning on doorways and crowds. So freezing of gait is one of the most disabling symptoms. Patients describe it as if the feet are glued to the floor even though the brain wants to move. So common triggers include turning doorways and crowded environments. It becomes more common in advanced diseases and contributes majorly to falls. This is where physiotherapy, cueing strategies, environmental modification, and mind-body regulation can extremely helpful. Next, now we had almost covered the gross motor functions. Now we are moving to the fine motor symptoms. So micrographia, buttoning difficulties, finger dexterity issues. So now let's shift to fine motor symptoms, the symptoms that affect handwriting, dressing, and daily independence. So fine motor symptoms may appear early and are often missed. So this include micrography, that means small handwriting, difficulty in buttoning and zipping, difficulty to wear the buttons of the shirt, and reduced finger dexterity, like taking the food, having the food with fingers, and reduced hand expressiveness. So, if we go to the more details of this, micrographia is very typical early sign. Handwriting became small, cramped, and progressively smaller. So, patients also struggle with picking up coins, using keys, mobile phone handling, fastening the clothes. So, these tasks appear simple, but they are emotional triggers too, because they affect dignity and independence. So motor symptoms are not just physical, they create a psychological and social impact as well. All right. So this brings us the end of the motor symptoms of Parkinson's disease, that is the gross motor symptoms and fine motor symptoms. The symptoms that are often most visible to the world, that is the tremor, rigidity, bradykinesia, kinesia, posture, and gait changes. But I want to leave with one very important perspective before I hand over this session to Dr. Nedu. Motor symptoms are only one part of Parkinson's disease. In fact, many patients tell us that what affects their daily comfort and confidence even more are the symptoms that people around them cannot easily see. These include changes in sleep, mood, digestion, energy levels, memory, anxiety, and autonomic function. And these are often the symptoms that quietly reduce quality of life long before tremor becomes prominent. So now, to take us deeper into the crucial part of Parkinson's disease, I'm honored to invite Dr. Needu S.J., who will guide us through a non-motor symptoms of Parkinson's disease and why they are so important for complete holistic management. Dr. Needu, over to you. Thank you.
Namaste everyone. Parkinson's disease is usually recognized as a movement disorder. Therefore, as Dr. Vijith mentioned earlier, most attention is given to motor symptoms such as tremor, slowness of movement, and muscle stiffness. However, PD also includes many symptoms not directly related to movement. These are called non-motor symptoms. Very often, these symptoms are ignored or not recognized as being related to Parkinson's disease. Today, we will bring those hidden challenges into the light so patients, families, and caregivers can recognize them early and respond with empathy and practical care. The first one, cognitive changes. It refers to changes in thinking, memory, attention, and decision making. First, an important clarification is not all Parkinson patients develop cognitive problems. However, in a large percentage of patients, especially as the disease progresses, mild to significant cognitive changes can occur. A common statement from families is, Doctor, it's not exactly forgetfulness, but thinking has become slow. This is a very accurate description. Just as slowness of movement in Parkinson's disease is called bradykinesia, slowness of thinking and processing information is called bradyphrenia. This is not a loss of intelligence, but a reduction in processing speed. For example, if someone talks to the patient while the TV is on, it may be difficult to follow both at the same time. Then coming to common cognitive issues. First, the most common early change in with attention and working memory. This means a person may find it harder to stay focused or to hold information in mind while doing a task. For example, they may forget what they are about to do or lose track of a conversation more easily. Second, there can be problems with executive functions. Executive functions are the brain's planning and organizing skills. A person may find it harder to plan activities, make decisions, organize tasks, or solve problems. The third is some people develop visuospatial difficulties. This means trouble judging distance or understanding where objects are in space. Patients may bump into furniture, misjudge steps, or having difficulty with parking a car. When these thinking changes are mild and do not significantly interfere with their daily life, we call this condition is mild cognitive impairment, MCI. It is important to know about 20 to 50% of people with PD can develop MCI at some point. An important point to remember is that not all cognitive problems come from the disease itself. Sometimes Parkinson's medications can cause confusion, slowed thinking, and reduced concentration. So we always review medications carefully. Why do these cognitive changes happen? There are several reasons. Parkinson's disease causes chemical changes in our brain. It is not only dopamine that is affected. Other chemicals like acetylcholine, serotonin, norepinephrine are also important for attention and memory. And Lewy bodies can spread to areas of the brain involved in thinking and memory. Other factors such as small strokes, blood vessel disease, or Alzheimer's types changes can also worsen this cognitive impairment. Then next to talk about stress and anxiety, something very common but often misunderstood. What is stress? Stress is the body's natural response to challenge, fear, or pressure. When we experience stress, the brain releases hormones such as adrenaline and cortisol. These hormones prepare the body for what we call the fight, flight, or freeze response. Then coming to types of stress. First is acute stress. This is sudden, short-term stress, such as exam pressure or an unexpected event. It usually resolves quickly once the situation passes. The second one is episodic acute stress. This occurs when acute stress happens repeatedly. Common symptoms are headaches, gastric issues, sleep disturbances, irritability, something like that. And third, chronic stress, the most dangerous form. This is the stress that continue for a long time, often due to financial difficulties, family conflicts, long-standing illness, something like that. And this chronic stress can lead to high blood pressure, poor control of diabetes, reduced immunity, sleep disorders. Over time, it increases the risk of Alzheimer's, dementia, and faster progression of Parkinson's disease. Another type of stress is perfectionist stress. This type of stress is self-imposed, driven by the need to be perfect. People with perfectionist stress often experience constant overthinking, fear of making mistakes, poor sleep, emotional burnout, something like. In conclusion, stress affects everyone differently, but understanding one's stress pattern is essential. Early recognition and timely evaluation can help prevent long-term physical and mental complications. The third is disturbances in the sense of smell. Many people with PD experience a reduction or complete loss of smell. This symptom is very common. Patient may describe it in simple ways such as food doesn't smell the same anymore. I can't smell coffee, tea or spices properly because smell is closely linked to taste. Food may also feel less enjoyable, which can affect appetite and their nutrition. An important point to understand is that loss of smell can occur very early in PD. In many cases, it appears months or even years before the typical motor symptoms. This happens because PD affects specific brain regions involved in smell perceptions early in its course. Abnormal protein deposits called Lewy bodies can damage the olfactory pathways before motor area of the brain are involved. Next is eye and vision problems. Parkinson's disease does not affect only their hands and legs. It can also affect the eyes and the way they move, which can lead to several visual difficulties. The first one is eye movement abnormalities. Many patients notice problems related to eye movements. Common complaints are difficulty reading, losing lines or skipping words while reading, double vision, eye strain or eye fatigue, like that. These problems occur because Parkinson's disease can affect different types of eye movements. Then the first eye movement is pursuit movement. These are the smooth movements that allow the eyes to track a moving object, such as watching a moving vehicle or a person walking. Second is saccades movements. Saccades are quick eye movements that shift the eyes from one point to another. They are especially important for reading as the eyes must rapidly jump from word to word and line to line. In PD, saccades may become slower, making reading effortful. In some patients, especially those with dyskinesia, saccades may become excessively fast or unstable. This leads to losing one's place while reading and needing to reread lines repeatedly. The third is vergence movements. Vergence movements allow both eyes to move together for near vision, such as reading or using a phone. Next is blinking abnormality. Blinking abnormality is also affected in PD. Reduced blinking is very common. This leads to dry eyes, burning, or irritation and redness of the eyes. The second is excessive blinking, that called blepharospasm. This is an involuntary, forceful eye closure that can interfere with vision. Another is apraxia of eyelid opening. In this condition, the person is unable to open their eyes voluntarily, even though the muscles are not weak. Another important point is retinal dopamine deficiency and visual processing. Dopamine is not only important for movement, it also important role in the light sensitive layer of the eye, that is retina. In PD, reduced retinal dopamine can lead to poor contrast sensitivity, colors appearing faded or dull, especially blue and yellow colors. Some patients may also experience visual hallucination. They may be related to the disease itself and the Parkinson's medications effect. Next, to talk about fatigue. Fatigue in PD is not ordinary tiredness. It is a true non-motor symptom of the disease and affect about 1/3 of Parkinson patients. Patients often describe in their own words such as, I have no energy even after resting. I don't feel motivated to do anything. This type of fatigue can happen even when a person is not physically active and may not improve fully with sleep. Why does fatigue happen in Parkinson's disease? There are several reasons. First is effect of Parkinson's medications. Second, poor physical conditioning. Third one, depression and sleep problems. The fourth, brain changes related to PD. That is, Parkinson's disease affect brain chemicals that control energy, motivation, and alertness, not just movement. So, fatigue can be a direct effect of the disease itself, not laziness or lack of effort. Next is a very important point, gastrointestinal issues. In people with PD, gut-related problems are extremely common. Among these, the most frequent problem is chronic constipation. In fact, about 80 to 90% of PD patients experience constipation at some point in their life. Why does constipation occur in PD? First, the main reason is that Parkinson's disease affects the body's autonomic functions. The gut moves forward automatically. In Parkinson's disease, this gut mobility becomes very slow. Then when the gut mobility slows down, stools take a long time to move through the intestines. As a result, stool become hard and difficult to pass, leading to constipation. Second thing is effect of Parkinson's medications. Some medications used to treat PD can further worsen constipation as a side effect. An interesting thing is our gut has its own independent nervous system called enteric nervous system. That's why the gut is often called the second brain. In Parkinson's disease, this gut nervous system is also affected, not just the brain. In Parkinson's disease, an abnormal protein called alpha-synuclein built up in the nerves lining the gut. These proteins deposit form structures called Lewy bodies. Then how the disease progresses in the gut. These Lewy body change usually appear in a specific order. First in the salivary glands, then into the food pipe, that means esophagus, then in the stomach, then in the small intestine, then in the large intestine, finally in the rectum. That's why Parkinson's patients may develop difficulty swallowing, food staying in the stomach for a long time, constipation. These Lewy bodies, changes in the gut can occur many years before tremor or movement problems begin. This often leads patients to ask, Doctor, does Parkinson's disease start in the gut and then go to the brain? For that, there is a specific theory called Bragg hypothesis. According to this theory, Parkinson's disease may start in the gut, then it spread upward to the brainstem through vagus nerve and later reach the midbrain. When the disease reaches a part of the midbrain called substantia nigra, the prime motor symptoms such as tremor, slowness of movements, body stiffness happen. Now, let's talk about how gut problems affect medicines. Many patients say, Doctor, sometimes I take the medicines, but it doesn't work. Very often, the reason lies in the gut function. Important medicines like levodopa are absorbed in the blood only when they reach the small intestine. If the gut movement is slow, the medicine stays trapped in the stomach. It doesn't reach the small intestine on time, so it is not absorbed properly. This leads to poor or absent effect of the dose. This is a major reason why many patients experience motor fluctuations. The next point is lightheadedness, that is neurogenic orthostatic hypotension. If you feel dizzy or lightheaded when you stand up suddenly from bed or a chair, or if your body feels light as though you might faint, it may not just be due to weakness or aging. Sometimes it can be related to Parkinson's disease. This is called neurogenic orthostatic hypotension. This is an important non-motor symptom of PD. What is neurogenic orthostatic hypotension? When we are lying down or sitting, our blood pressure is usually normal. When we stand up, gravity pulls blood downward, especially our legs. This is normal and happens to everyone. In a healthy person, the autonomic nervous system reacts immediately. It releases a chemical called norepinephrine. This tightens our blood vessels. Blood pressure is maintained. Enough blood continues to reach the brain. So when a healthy person stand up, nothing happens. But in some people with PD, the autonomic nervous system doesn't work properly. Norepinephrine is not released sufficiently. Blood vessels do not tighten as they should. As a result, blood pressure drops suddenly on standing. Less blood reaches the brain. This sudden drop in the blood pressure is called neurogenic orthostatic hypotension. Some symptoms are dizziness, a darkening of vision, that is blackouts, difficulty concentrating, blurring in the vision, pain or tightness in the neck and shoulder, or general weakness. Most important things are it increases the risk of falls. Falls can lead to serious injuries. That's why NOH should never be ignored or taken lightly. Next is pain. Studies shows that about 40 to 80 percentage of people with PD experiences pain at some point. Sometimes it can be difficult to know whether the pain is caused by PD or due to common problems like arthritis or muscle strain. For example, a person with PD may have shoulder pain. Initially, this pain may be thought to be a frozen shoulder or arthritis. Later, if resting tremor appears on the same side, it becomes clear that the pain was not an orthopedic problem but was caused by Parkinson's related muscle stiffness called rigidity. That's why it is very important to understand. Then coming to type of pain in Parkinson's disease. First is musculoskeletal pain. It is the most common form of pain in PD. This type of pain affects our muscles, bones, and joints. And second one is dystonic pain. Dystonic pain is caused by abnormal involuntary muscle contractions. In Parkinson's patients, this pain often occurs when dopamine levels are low before taking the next dose of medications, when a medication dose is wearing off. And third one is radicular pain, that is nerve pain. Patient often describe it a shooting pain or electric shock like sensation. That pain can that travel down the arm or leg. In Parkinson's patients, stooped posture, spinal alignment problems can increase pressure on nerves, making radicular pain more common. And the last, central pain, most complex type. Central pain comes from problems in the brain and spinal cord, not from muscles or joints. And patient may describe central pain as deep aching pain, burning or stabbing pain, pain that feel different in different parts of the body. And next to talk about changes in personality that can happen in PD. This is a very important topic, especially for family members. PD affect more than movement. It can also change how a person thinks, feels, and behaves. These personality changes happen because the disease causes changes in the brain and they are natural, unintentional, and beyond the person's control. Family members may notice loss of interest in activities, social withdrawal, difficulty planning, or reduced hopefulness, sometimes even early in the disease. These changes can affect daily life and relationship, often leading families to feel that their loved one is not the same anymore. It is important to understand that expecting the person to remain unchanged is unrealistic, just like expecting tremors to stop by willpower alone. Acceptance, understanding, and compassionate adjustment of expectations help families support their loved ones with care and dignity. Next is some people with Parkinson disease may experience problems with perception and thinking. And one of the important problem is psychosis. What is psychosis in PD? Psychosis is a condition where a person experiences things that are not real. There are two types of psychosis. First is hallucination, second is delusion. Hallucination means seeing or hearing things that are not actually there. For example, seeing people or animals in the house that are not there, hearing someone calling their name when no one is there, feeling that someone is nearby even when no one is there. Patient often say, I can see things right in front of my eyes. Second is delusion, believing in things that are not true. For example, someone is following me, my family is trying to harm or cheat me, someone is stealing my belongings, something like that. Studies show that more than half of the people with PD may experience hallucinations or delusion at some point in their life. The two main causes psychosis in Parkinson's disease are medications and brain changes from Parkinson's disease itself. And the key points for family members, psychosis is common and part of Parkinson's disease. Patients cannot control their experiences, so blame or punishment is very wrong. Recognizing psychosis early is important for safety and proper treatment. Openly talking with the doctor helps to adjust medications if needed, provide appropriate treatment for hallucination or delusion, improve their quality of life for both patient and family members. Next, we talk about a very important point that many people feel shy discussing, but is very important: sexual concerns. Parkinson's disease can significantly affect a person's marital and sexual life. Common sexual concerns in PDs are reduced sexual desire. Second is difficulty achieving sexual pleasure or orgasm. Third is physical challenges affecting sexual activities because muscle stiffness, slowed movement, tremor, fatigue, or general body discomfort can make intimacy more difficult. Fourth is medication-related effect. Some Parkinson's medications can reduce sexual desire, while in rare cases, certain medications may cause excessive sexual urges. It is important to understand that these changes are medication effect, not intentional behavior. Next, let's see the relationship and situation factors which affect these issues. Long-term caregiving responsibilities, stress, anxiety, fatigue can affect both partners, not just the patient. Parkinson's often worsens at night, which can limit opportunities for intimacy. Many couples may start sleeping in different beds due to physical or symptom-related issues. How to manage sexual concerns? Open communication is the main key. Partners should discuss changes in sexual desire, comfort, and physical ability openly and honestly. Talk to your doctor. Small adjustment in Parkinson's or depression medications can improve sexual functions in many cases. Never feel ashamed to bring up sexual concerns. Doctors are trained to help. Consider counseling. Couple counseling or sexual therapy can help improve intimacy even when physical limitations exist. Next is sleep problems. Normally, nighttime is the time when the body and mind rest and recharge. But in PD, many people find that nighttime becomes a period of difficulty rather than rest. Studies shows that the people with PD often get only 4 to 5 hours of sleep at night, and they wake up multiple times more often than people of the same age without Parkinson's disease. This lack of restoration sleep can lead to excessive daytime sleepiness, fatigue, trouble concentrating. Then next, Types of sleep problems in PD. First is difficulty falling asleep. Second is frequent nighttime awakening, sleep apnea, effect of medications. If Parkinson's medications are not timed well, they can interfere with sleep. Next is frequent nighttime urination. 6, nighttime confusion or hallucination. And last one, sleep-related movements. Talking, shouting, or physically moving during the sleep can occur. This can be due to Parkinson's related changes in the brain or medication effect. Next is urinary issues. Parkinson's disease can affect the nerves and muscles that control the bladder. As a result, many patients notice changes in how they urinate. Some of the common issues include frequent urination, urgency, nighttime urination, nocturia, difficult starting urination, incomplete bladder emptying, dribbling or a weak stream, urge incontinence, like that. The last one is weight loss. Nowadays, many people are trying to lose weight intentionally. But in PD, a lot of patients experience unintentional weight loss, and this can be concerning. First, it is very important not to assume that the weight loss is automatically because of Parkinson's. Other conditions like cancer, thyroid disorders, hormonal problems, or gastrointestinal disease can also cause weight loss. That's why your doctor will usually recommend tests to rule out other causes before linking weight loss to Parkinson's disease. Why weight loss happens in Parkinson's disease? First point is loss of appetite. Early in the disease, the ability of smell and taste food may decrease. When food doesn't smell or taste as good, people naturally eat less without realizing it. The second point is low motivation and depression. Patient may feel less interested in preparing or eating food. Depression, which is common in Parkinson's disease, can further reduce appetite. Third is side effect of medications. Some medications can cause nausea or loss of appetite. Parkinson's can also slow stomach emptying, delayed gastric emptying, making you feel full quickly. The fourth point is increased energy expenditure. Some patients develop involuntary movements, that is dyskinesia, due to medications or the disease itself. Continuous movements throughout the day burns extra calories, contributing to weight loss. The fifth point is difficulty swallowing, dysphagia. Fear of choking or coughing can make patients eat smaller amounts. This reduces calorie intake further. The sixth is gastrointestinal problems. Slower gut movement can make digestion less efficient. Food may not be fully absorbed, which can also contribute to weight loss. So, Parkinson's is more than tremors. Non-motor symptoms often start years earlier, silently affecting our daily life and mental health. Recognizing and managing them early can improve their quality of life, make treatments more effective, and help us truly understand the full picture of the disease. Thank you. Next, I invite Dr. Aditya, Resident Medical Officer at VIAMS, to explain the role of Ayurvedic treatment and Panchakarma in Parkinson's disease. Doctor, over to you.
Thank you, Dr. Neetu. Good evening, everyone. We have just heard about the wide range of motor and non-motor symptoms that people living with Parkinson's disease face every day. For patients and caregivers, the natural next question is,
What can be done to manage these challenges effectively and gently? This is where Ayurveda offers a holistic approach, addressing not just symptoms, but the individuals as a whole. Now, let me begin with the foundation of Ayurvedic management in Parkinson's disease. In Ayurveda, management is not limited to internal and external medicines alone. It is a comprehensive approach that also includes Ayurveda therapies and Panchakarma treatments. Together, these components work in a coordinated manner to address symptoms, balance Vata dosha, support the nervous system, and improve overall quality of life. In Ayurveda, Parkinson's disease closely resembles a Vata-dominant neurodegenerative condition where the normal movement, coordination, and communication of the nervous system gradually get disturbed. So our primary goal is not only symptom control, but also neuroprotection, slowing progression, and improving quality of life. First, let's talk about internal medicines. The core focus of Ayurvedic internal medication in Parkinson's disease is to balance Vata dosha, which is considered the primary pathology behind tremors, stiffness, slowness, and instability. These medicines work at multiple levels. They help improve neuromuscular coordination, making movement smoother and more controlled. They support brain and nerve function, especially areas responsible for movement and cognition. They enhance digestive fire or acne, which is extremely important because in Ayurveda, even the best medicine will not work optimally if digestion and metabolism are weak. By improving acne, we also ensure better response to all treatments, including Panchakarma and modern medications if the patient is taking them. Now, coming to the commonly used categories, Medhi Rasayanas, which support memory, cognition, and nervous system nourishment. Vadahara formulations, which calm aggravated Vata and reduce symptoms like tremors, rigidity, and restlessness. Rasayana medicines, which are long-term rejuvenators aimed at slowing degeneration and improving vitality. Clinically, when internal medicines are administered consistently and appropriately, we observe meaningful and progressive changes in patients with Parkinson's disease. Their movements to become smoother and less effort dependent. Patients often experience improved mobility, better muscle strength, and increased energy levels, which help them perform daily activities with greater confidence. Equally important is the improvement in sleep quality and mental well-being. As anxiety, low mood, and disturbed sleep commonly aggravate Parkinson's symptoms, stabilizing these aspects leads to a better overall symptom control and emotional resilience. Thus, internal medicines from the core systemic support in Ayurvedic Parkinson's management, addressing all functional well-being. The next is external medicines. Along with internal medicines, Ayurveda gives equal importance to external medicines and local therapeutic applications. These are most often administered using medicated oils, either applied directly to the body or incorporated into specific treatment procedures. The primary aim of external therapies is to relax rigid and stiff muscles, which are a major concern in Parkinson's disease. They also help nourish the nerves and joints, improve local circulation, and enhance flexibility, thereby supporting better posture and smoother movement. From a patient's perspective, the benefits are often immediate and clearly noticeable. Many patients experience a reduction in rigidity, pain, and muscle tightness, along with a sense of lightness, relaxation, and ease of movement. These changes significantly improve daily comfort and confidence. External medicines also play a vital preparatory role. By conditioning the body and calming the nervous system, they enhance the effectiveness of Panchakarma therapies and improve the body's response to treatment. So, while internal medicines, external medicine provide direct support and calming effects, making them an essential part of holistic Ayurvedic management in Parkinson's disease. When we combine these internal and external medicines, we create a strong therapeutic base. And now that we have understood how Ayurvedic internal and external medicines work at a systemic level, the next important question is, how do we physically influence the body, nerves, and brain to correct Vata imbalance and restore movement? This is where Ayurveda therapies and Panchakarma plays a crucial role. These therapies act layer by layer from the skin and muscles to the deepest nervous system, creating both symptomatic relief and long-term neurological support. In Ayurveda, therapies are planned in a very structured, layer-wise manner. Instead of directly acting on deeper tissues, we first address the outmost layers of the body to gently pacify aggravated Vata and prepare the system for deeper innervations. The first level we focus on is the superficial or skin muscle layer, known in Ayurveda as a Twak and Mamsa Dhatu level. This layer is where early stiffness, dryness manifest in Parkinson's disease. To address these changes, we start with one of the most fundamental and effective Ayurvedic therapies, that is the Abhyanga or medicated oil massage. The action of Abhyanga goes beyond simple surface relaxation. At a therapeutic level, it helps pacify aggravated superficial Vata, which is responsible for dryness, stiffness, and irregular movements seen in Parkinson's disease. By improving local blood circulation, Abhyangam enhances oxygen and nutrient delivery to the skin, muscles, and peripheral nerves. It also effectively reduces muscle stiffness and tissue dryness, restoring softness and elasticity to the muscles. Clinically, in patients with Parkinson's disease, these effects translate into relief from early rigidity and muscular tightness. Patients often experience improved flexibility, smoother movements, and greater physical comfort even during routine activities. Most importantly, Abhyangam serves a preparatory role in the treatment protocol. By softening muscles and calming the nervous system, it prepares the body for deeper Ayurvedic therapy. Making the muscles and nerves merely a massage, it is the first essential step in neuromuscular conditioning in Ayurvedic Parkinson's management. The next is Kiri, the Potli massage. As Parkinson's disease progresses, stiffness does not remain limited to the surface muscles. It gradually extends deeper into the muscles, tendons, ligaments, and joints, leading to restricted movements, pain, and altered walking patterns. At this stage, simple superficial therapies are often not sufficient, and this is where Kiri therapies, also known as Potli massage, becomes particularly effective. Kiri works at a deeper level, acting on the Mamsa Dhatu, the snayu or tendon, ligament structures, and the joints involved in movement. Through the combined effect of heat, pressure, and medicated substances, Kiri brings about deep muscle relaxation, helps release contractions and tightness, and gradually improves the range of motion with Parkinson's disease. It helps reduce limb rigidity, supports better gait mechanics and balance, and it's especially useful in individuals who experience painful stiffness and significant movement restriction. By repeatedly encouraging relaxed and guided movement, Kiri helps the body relearn smoother, more coordinated motor patterns, making it an important therapeutic step in restoring functional mobility in Parkinson's disease. The next treatment is spiritual. When Parkinson's disease begins to involve the neuromuscular approach is required. This is where spiritual plays a very significant role in Ayurvedic management. Pirichil acts deeply in the nervous system and the Vata channels that governs movement and nerve transmission throughout the body. The continuous application of warm medicated oils creates a sustained therapeutic environment that allows deep penetration into these tissues. The actions of Pirichil includes profound pacification of aggravated Vata, defoliation and nourishment of nerves and strengthening of neuromuscular coordination. This helps stabilize nerve impulses and improve communication between the brain and muscles. Clinically, in patients with Parkinson's disease, Pirichil has shown to be particularly beneficial in controlling tremors, improving posture and walking patterns, and enhancing overall movement stability. It is especially useful in moderate to advanced stages of the disease where deeper nerve systems involvement is more pronounced. Overall, Pirichil provides a deeply calming and stabilizing effect on the nervous system, offering both physical relief and neurological support in Parkinson's disease management. Finally, after subsequently addressing the superficial layers with Abhyangam, the deeper muscle and joint involvement with Kiri, and the neuromuscular system with Pirichil, the Ayurvedic therapeutic approach concludes in Navarakiri. It's the Shashtiga Pindasweda. As Parkinson's disease progresses over time, many patients, particularly the elderly and those with a long-standing illness, begin to experience marked weakness, easy fatigability, and a gradual loss of physical endurance. At this stage, the focus of treatment shifts from symptom control alone to restoration, nourishment, and strengthening, and this is where Navarakiri becomes invaluable. Navarakiri acts as the deepest rejuvenative level, influencing the Majja Dhatu, which governs the nervous system, the Shukra Dhatu associated with the tissue strength and vitality, and ultimately Ojas, the essence responsible for immunity, resilience, and overall well-being. The therapeutic actions of Navarakiri includes Brahmana or deep nourishment of tissues, along with the strong Rasayana effect, which supports regeneration and slows degeneration. Through this, it helps restore strength, stamina, and endurance in weakened patients. Clinically, Navarakiri has shown significant benefits in Parkinson's disease by improving muscle strength and tone, reducing fatigue and exhaustion, and enhancing overall functional capacity. It is especially well suited for debilitated, elderly, or fragile patients who may not tolerate more intensive therapies. By nurturing the body at the level of Ojas, Navarakiri supports long-term stability, resilience, and quality of life, making it a vital component of holistic Ayurvedic Parkinson's care. So, when we look at Ayurvedic therapies as a whole, they are not isolated procedures, but a carefully planned, stepwise approach. Abhyangam addresses the superficial layers by calming Vata and reducing early stiffness. Kiri works deeper into the muscles, tendons, and joints to relieve rigidity and improve mobility. Pirichil acts at the neuromuscular and nervous system level, stabilizing movements and improving coordination. Finally, Navarakiri focuses on rejuvenation and strengthening, restoring endurance and vitality, especially in long-standing or elderly patients. Together, these therapies work layer by layer, moving from surface relaxation to deep neurological support and finally to rejuvenation. This integrated approach helps reduce symptoms, improve functional capacity, and enhance overall quality of life in people living with Parkinson's disease. While these therapies provide powerful and supportive benefits, Ayurveda goes to step deeper with Panchakarma treatments. In Ayurveda, Panchakarma refers to 5 classical purification therapies, that is Vamanam, Virejanam, Nasyam, Vasti, and Raktamoksham. These therapies are designed to cleanse the body, correct doshic imbalance, and restore physiological balance. Among these 5 Panchakarma procedures, Nasyam, Vasti, and Virejanam are the most commonly and effectively used in Parkinson's disease as they directly address Vata imbalance, nervous system dysfunction, and digestive support. Nasya is one of the most important Panchakarma therapies in the management of Parkinson's disease, particularly because of its direct action on the brain and nervous system. In this therapy, specially prepared medicated oils or herbal drops are administered through the nasal route, and Ayurveda considers the nose to be the direct gateway to the brain. Through this pathway, Nasya helps calm overactive and irregular nerve signals, which are responsible for symptoms such as tremors, facial rigidity, and difficulty in speech. It also has a profound effect on the mind, helping to improve sleep quality, reduce restlessness, and promote mental calmness. Because Nasya acts directly at the level of the brain and central nervous system, it is particularly effective in the early stages of Parkinson's disease, where timely intervention can help slow symptom progression and improve neurological stability. Among all Panchakarma therapies, Vasti is regarded as the most important and effective treatment for Vata disorders and therefore holds a central place in the Ayurvedic management of Parkinson's disease. Ayurveda clearly states that Vata resides primarily in the colon, and any imbalance at this level directly affects the nerve functions and movement. In Vasti therapy, medicated liquids such as herbal decoctions and medicated oils are administered through the rectal route. This region plays a crucial role in regulating Vata dosha and maintaining proper nerve balance throughout the body. Clinically, Vasti produces wide-ranging benefits in Parkinson's disease. It helps reduce muscle stiffness and rigidity, improves slowness of movement, enhances walking pattern and overall coordination, and effectively relieves constipation, which is a very common and often distressing non-motor symptom in Parkinson's patients. What makes Vasti particularly unique is its whole body effect. Rather than offering only local relief, it acts systemically by stabilizing Vata at its root, influencing the nervous system, muscles, and digestive tract simultaneously. For this reason, Vasti is considered a cornerstone therapy in Parkinson's disease management, forming the backbone of long-term Ayurvedic treatment plans. Finally, Virajana is a gentle and well-controlled cleansing therapy that plays a supportive yet very important role in the management of Parkinson's disease. While Parkinson's is a primarily neurological disorder, Ayurveda emphasizes that optimal digestion and metabolism are essential for effective nervous system function and treatment response. Virajana helps by eliminating accumulated toxins and metabolic waste, thereby clearing the digestive and metabolic pathways. This process improves digestive fire, metabolism, and overall energy levels, which are often compromised in Parkinson's patients due to reduced activity, medications, and disease progression. When the digestive system is clean and functioning efficiently, the body is better able to absorb and utilize medicines, respond more effectively to therapies, and maintain sustained energy throughout the day. Patients often report reduced fatigue, heaviness, and mental dullness following Virajana. In Ayurveda, digestion and the nervous system are closely interconnected. When digestion improves, the brain and nerves also function more efficiently, making Virajana an essential supportive Panchakarma therapy that enhances the overall effectiveness of Parkinson's disease management. To conclude, Ayurveda offers a comprehensive and holistic approach to the management of Parkinson's disease through a well-integrated combination of therapies and Panchakarma treatments. With that, I come to the end of my session on the Ayurvedic therapies and Panchakarma approach in Parkinson's disease. To take this discussion forward into practical daily life applications, it is my pleasure to welcome Dr. Prasita AP, our healthcare advisor, who will be speaking on daily routines and lifestyle modifications in Parkinson's disease. Over to you, Doctor.
Thank you, Dr. Aditya, and good evening, everyone. So today we shall discuss about the daily routines, the holistic way one should follow in Parkinson's disease treatment. So let me start with the morning routine. So in Ayurveda, the way we begin in the morning has a profound impact on nervous system and overall balance. So for individuals with chronic neurological conditions, the focus should be on a gentle, unhurried start to the day. So like after waking, before getting out of bed, patients can be encouraged to do light stretching and simple balance training exercise while still on the bed. So this may include gentle limb movements, slow ankle and wrist rotations, knee bending, and controlled rolling or sitting balance practices. So performing these exercises on the bed is safe. It reduces the risk of falls and it helps loosen stiffness that is often more pronounced in the early morning hours. And it also improves body awareness and prepares the patient mentally and physically for movement. So generally, for the patients who have been in our IP treatment, the experts from our physiotherapy department often demonstrate what kind of exercise they should do while after waking up. So they will demonstrate what kind of exercise, how many times to do, at what intervals, and all. So once these gentle movements are completed, abhyanga or oil application can be introduced. So even a short oil massage, especially to scalp, ears, spine, hands, and feet, has a calming and nourishing effect on nervous system. So actually, Abhyanga helps to reduce rigidity. It improves circulation and supports sensory and motor coordination. Generally, the patient who have completed our IP treatment might know how to apply this oil, in what direction, okay, how many, the duration and all. So this can be followed by light movements or stretches of the bed according to the individual capacity, and then progressing toward establishing a regular bowel routine, which is a key goal of the morning hours in Ayurveda. So overall, the emphasis should be on a calm, stress-free, and predictable morning routine, avoiding haste or pressure, as this greatly supports both physical stability and emotional well-being. And next is the dietary discipline and the meal timing. So generally, the patients who has just completed our consultation before taking our medication, or some patient may contact us on the phone before taking our consultation, and they have a common concern whether taking our treatment, we just they want to follow a strict diet or not, because for everyone Ayurveda just means to follow a strict diet. So actually, we don't advise patients to follow a strict diet, but in case of Parkinson's, generally the metabolism, the digestion of the Parkinson patient will be generally low. So the experts from our dietetics and nutrition usually advise them what kind of food they have to take. Okay, so diet is not just about what we eat, but how and when we eat. So actually warm, freshly prepared and easily digestible foods are ideal. So such foods support acne, it means improve digestion, and it prevent bloating or heaviness. Cold, dry, processed or leftover foods tend to aggravate vata and should be minimized. And regular meal timings are extremely important. Irregular eating patterns disturb digestion and energy levels. And patients should also maintain adequate hydration, taking small sips of warm or room temperature water throughout the day. And heavy meals and late night eating and erratic food habits should be avoided, as they increase fatigue, indigestion, and discomfort. Next is activity rest balance. Actually, one common mistake we see is either overexertion or completely inactivity. Both are harmful. So, physical activity should be planned, it should be gentle and appropriate to the patient's capacity. So, equally important are adequate rest periods. So, the body needs time to recover, especially when neurological fatigue is present. So, patients should be taught energy conservation techniques, breaking tasks into smaller steps, avoiding unnecessary strain, and pacing activities throughout the day. And this balance helps maintain independence without exhaustion. So, we usually appreciate patients to do the physiotherapy exercises at regular timings each day. So, we usually provide them with correct schedules of exercises. Next is mind body wellness practices. So the body and the mind are deeply interconnected. So simple breathing exercises or pranayama help calm the nervous system and improve focus. And meditation, guided relaxation, or even quiet sitting can reduce anxiety and improve emotional stability. So encouraging positive daily habits such as gratitude, structured routines, and meaningful engagement supports mental health. Emotional self-care is crucial as chronic illness often brings fear, frustration, or low mood. So, addressing this compassionately is part of holistic healing. So, next is the real world lifestyle modifications. So, now let's to look at how these principles translate into practical real world changes. So, what all the home and environment adjustments that we can do? Let's look at that. So, the home environment should support safety and confidence. So, simple steps like fall proofing the house, removing loose rugs, ensuring adequate lighting, and installing support rails can significantly reduce the risk of injury. And we always suggest warm light instead of bright lights. Okay, that is one thing behind that is to promote sleep of the patient. So warm light always increases release of melatonin, one of the hormone that promotes sleep. So then also the furnitures that should be arranged in a way that allows easy movement, and bathrooms should be modified for safety and accessibility. So these changes may appear small, but they greatly improve independence and reduce fear. So next is caregiver role and family support. So actually there is no holistic plan is complete without addressing the role of caregivers and family. So symptoms often vary from day to day, and understanding this variability prevents frustration. So caregivers provide not only physical help but also emotional and motivational support. So at the same time, patients should be encouraged do as much as safe they can on their own to preserve dignity and self worth. We must also remember to address the caregiver burnout as their well being directly affects patient care. So, finally, long term holistic management. So, finally, holistic care is a long term journey. Okay, it's not a short term intervention. So, integrating Ayurveda therapies with modern medical care. As I have already told you, we have physiotherapy, speech therapy, dietetics, yoga therapy. So, all these are supportive modern therapies that can be integrated along with our Ayurveda. So, this ensure a comprehensive management of Parkinson treatment. So, regular health monitoring, follow ups, and reassessments are very essential. So, patient education empowers individuals to take ownership of their health. So, ultimately, our goal is not just symptom control, but preserving dignity, independence, and quality of life. So, this is what I meant to discuss with you. Thank you. And now I would like to invite Dr. Vijith to give the concluding remarks and key takeaways from today's session. Thank you.
Thank you, Prasida. So we are moving to the conclusion and takeaways of today's webinar as we are running out of time. So as we conclude, I want to leave you with one message. Parkinson's disease, it's not only a neurological diagnosis, it's a life journey. And the goal is not merely survival, but meaningful living. Modern medicine plays a vital role in symptom management, especially for motor control. But to truly improve day-to-day function, we must look beyond tablets and terror scores. We must address movement confidence, gut health and constipation, sleep quality, stress and emotional resilience, fatigue and cognition, fall prevention and home safety, caregiver support, and long-term consistency. The integrated model where Ayurveda, Panchakarma, diet, physiotherapy, yoga and counseling, and lifestyle regulation work together creates a powerful foundation for holistic management, holistic symptom management. Thank you for your valuable time today. It was a privilege to share this session with the participants from almost all the states. So the final takeaway is Parkinson is more than a tremor. It affects sleep, digestion, mood, cognition, and autonomic function. Motor symptoms include tremor, rigidity, gait problems, and fine motor issues that reduces independence. Non-motor symptoms often begin early and significantly impact quality of life. Ayurveda focuses on Vata imbalance, neuroprotection, plus functional preservation, not only symptom suppression. Then Panchakarma therapies like Nasi and Vasti support nervous system regulation and gut-brain balance. Daily routine plus stress reduction plus safe movement practices create long-term stability. The best outcomes from integrative support care involving caregivers and rehabilitation support. Thank you. Thank you very much. Now, if you have anybody have any questions, we can interact. Either you can type in your chat box, or you can just unmute your mic and ask. We are happy to answer those questions. Dr. Aditya, any questions in the chat box?
No, sir.
Okay, fine. So this is our contact details. If you want to contact, please do call or WhatsApp in this number. And I would like to announce the February month webinar. The theme is integrated neuro rehabilitation, how Ayurveda, physiotherapy, speech therapy, mind-body practices work together. So the main sessions will be the VIAMS integrated protocol will be explained, then Panchakarma for neurodegeneration, role of physiotherapy and movement re-education, speech and swallowing therapy, psychology and emotional health, yoga, and a case workflow, how multidisciplinary teams improve outcomes. So the next month, like a rehabilitation of our physiotherapist, clinical psychologist, speech therapist, everybody will be taking the sessions as a part of this integrated treatment protocol. Thank you. Thank you very much.